Hi, my name is Bobby. I'm gonna be your nurse today. What's your name?
Sarah,
How old are you?
22.
So today I'm gonna be doing an assessment on your head, face, eyes, ears, nose, throat, and mouth. Okay, so first let me start with direction my hands. So I'm gonna start off by palpating your head. I'm feeling for any lumps, bumps, or bruises, any lesions. No dandruff in the hair. It's clean. Next I'm gonna move onto your face. Remove your glasses. So when I do this, I'm looking for symmetry. So I'm looking at your eyebrows, your eyes, nose, mouth, and ears, and your face is symmetrical. Next, I'm going to check your temporal artery. So I'm checking your pulse right now. It's bounding. Next, I'm going to check your cranial nerve 5. So open your mouth for me, close it, and clench your teeth for me. Okay, good job. Next, I'm going to check cranial nerve 7. So I want you to smile for me, frown, and puff out your cheeks for me. Nice. All right, so next I'm going to be doing your frontal sinus and your maxillary sinus. So I'm going to be palpating those to see if they're congested or anything. And real good. Next, I'm going to move on to your eyes. So can you close your eyes for me? So right now I'm looking at your eyebrows, eyelashes, and your eyelids, and they all seem to be pretty good and intact. Next, I'm going to move to your conjunctiva, and I'm checking down here. It's pink, moist, and intact. Next, I'm checking your sclera and your iris. So I gotta get the pen light. So will you look away from me so I can see the whites of your eyes? So right now I'm checking the sclera, right? And let me do it to the opposite side. Oh, good. And next I'm gonna check your pupil reflex. And so, all right, now I'm gonna check your cranial nerve number 2. So can you read this to me?
Alcohol.
Okay. And next I'm gonna check cranial nerve 3, 4, and 6. So I need you to follow the tip of my pen for me. Okay. And keep your head still. Okay, and while you still keep your head still, can you look at the tip of my pen? And can you look behind me at the wall? Now look at the tip of my pen again. Look behind me at the wall. Okay, thank you. So next after that, we're gonna be moving to your nose. And so for your nose, I'm checking for symmetry with that also. And will you look up for me? So I'm checking your mucosa and your septum, and they're both together and intact. Next, I'm gonna check your cranial nerve number 1. And so can you smell that? What do you smell?
Alcohol.
Okay, good job. And next I'm moving to your ears. So with your ears, so they both look symmetrical and even on your head, and there's no drainage coming from them or anything. And so I'm going to be taking cranial nerve number 8. So can I ask you to take a finger and to plug it with your plug your ear with your finger? And so I'm going to whisper in your ear, and I want you to repeat to me what I say. Clay.
Clay.
Pottery.
Pottery.
Okay, thank you. And so whenever I do that, is there any tenderness on your ears at all? Anywhere?
No.
Okay, I'm going to check inside of it to make sure. No drainage? Anything?
No.
Everything's intact? Okay. Next, I'm going to be moving to your mouth for you. So can you show me your lips? So I'm looking at your lips. No cracks, no lesions on them. They seem moist. They're not dry. I moved inside your mouth for me. So can you open your mouth for me? Show me your tonsils. So when I'm doing this, I'm checking your teeth, tongue, all the mucous membranes, your gums, your soft palate, your hard palate, and they all seem to be pretty good and intact for me. So next I'm going to move to cranial nerve 9. So can you swallow for me? Okay, next I'm going to do cranial nerve 10. So can you open your mouth and go ah for me? Okay. And after that, I'm going to do cranial nerve 12. So I need you to stick your tongue out for me and move it side to side. Okay, and can you say light, tight, and dynamite for me?
Light, tight, dynamite.
Okay, thank you. So after that, I'm going to move to the neck assessment. So whenever I move to your neck, I'm making sure that your trachea is midline, and I'm looking for any lumps, bumps, or lesions. And seems like you don't have any to me. After that, I'm going to be assessing your lymph nodes. So a lymph node will get swollen if you have some kind of infection or anything. And so whenever I do that, I'm going to start. And this is your pericular lymph node, postauricular lymph node, occipital, submandibular, submental, and jejunum lymph node. And then after that, I'm going to do your posterior cervical, your superficial cervical, and your anterior cervical lymph node. And then I'm going to check here, and will you arch your shoulders for me? And your supraclavicular, and I don't feel any of your lymph nodes, so that's a good thing. And next, I'm going to be doing a thyroid assessment on you. So I'm going to put my hands right here, and so turn towards this camera. And so I'm going to ask you to lean your head to the right for me and swallow. Okay, and will you lean your head to the left for me? I'm doing a report on a 22-year-old female. I did an assessment of her head, face, eyes, ears, nose, throat, and mouth. Assessment of the head, she denied any tenderness to the head. There was no lumps, bumps, or lesions on the scalp. It was clear of any irritation. There was no dandruff. The hair was blonde and clean. And the assessment of the face is very symmetrical. Whenever I palpated the temporal artery, it was bounding. Cranial nerve 5 and 7 were intact. She denies any tenderness. Assessment of the eyes, there was no drainage or irritation noted. Eyes were both symmetrical. Conjunctiva was moist and pink. Sclera white. Iris blue. Cornea was round. Cranial nerve 2, 3, and 4 and 6 were intact. The nose was symmetrical. There was no drainage noted. The mucosa was pink and moist. Septum was intact, and cranial nerve 1 was intact. Assessment of the ears, there was no drainage. She denied tenderness in either ear. Cranial nerve 8 was intact, and the ears were clear. Assessment of the mouth, there was no cracking or lesions on the lips. The teeth, gums, tongue, soft palate, hard palate, and tonsils were all pink and intact. Cranial nerve 9, 10, and 12 were intact. Assessment of the neck, trachea was midline, everything was symmetrical, there was no lumps, bumps, or lesions. All lymph nodes were intact and palpable. Thyroid was palpated without any enlargement or tenderness in her throat at all.